Good morning, everyone. My name's Wanmaka Inmasom. I'm glad to be here to present on risk factor associated with multiple recurrent febrile seizure in children aged 6 months to 5 years who present with their first episode of febrile seizure. Approximately 30% of children with the first febrile seizure will experience recurrence, increasing parental anxiety and the future risk of epilepsy. Previous studies have identified risk factors for recurrence, which define the outcome as a simple yes or no. However, there has been no research addressing those for multiple recurrence. Therefore, this study aimed to identify risk factors associated with multiple recurrence of febrile seizure in children aged 6 months to 5 years who have experienced their first febrile seizure. This prognostic research was designed as an retrospective cohort study in an exploratory model. The determinants include gender, age, family history of epilepsy or febrile seizure, type and recurrence of febrile seizure within 24 hours, MCV, and neutrophil to lymphocyte ratio. The outcome was the episode of recurrent febrile seizure, classified as an ordinal outcome. Baseline characteristics were compared, both categorical and numerical data, using a non-parametric trace for trend or NP trend. Over 10 years of data collection, 561 children were included. After exclusion, 405 patients remain for analysis, classified into four groups: the third, second, first, recurrent, and no recurrent. Using the multivariable continuation ratio for ordinal logistic regression or Ocasio model, the independent factors associated with recurrent febrile seizure ranked by effect size are as follows. First, the initial febrile seizure occurred before 12 months of age. Second, a family history of epilepsy. Third, an MCV below 70. Discussion: in children under 12 months, brain neurons are still immature, lowering seizure threshold. A family history of epilepsy increased the chance of recurrent febrile seizure due to genetics. Iron deficiency is an independent factor for recurrent febrile seizure. However, comprehensive testing is not feasible for every case in our hospital. Therefore, we use an MCV below 70 as a proxy indicator for iron deficiency. In conclusion, if a patient experiences their first febrile seizure before 12 months of age and has a family history of epilepsy, parents should be advised to take prompt action during any fever. This includes regular therapy response and giving oral acetaminophen every 4 hours. Additionally, an MCV below 70 should be investigated and treated to prevent recurrence. I would like to acknowledge the person listed above for their assistance and will end the presentation at this point. Thank you.
So you said the MCV is one of the indicator for this study.
Yes.
So did you confirm the iron deficiency anemia by sending the iron study? Because the Thailand, as you know, is the endemic area of thalassemia,
Yes.
and one of the hematological finding of thalassemia is the low MCV.
We use MCV just as the proxy indicator because from the data collection in our hospital, we investigate about anemia, uh, not send the definite such as serum ion study. We just use as a proxy. We not confirm that MCV below 70 as iron deficiency, but we found in previous study that have associate between iron deficiency and recurrent febrile seizure.
Okay. And the second question, what is the rationale of using the neutrophil lymphocyte ratios
Uh,
as a risk factor?
from again, from the previous study, we found neutrophil to lymphocyte ratio. If neutrophil to lymphocyte ratio is more and more, it's an increased risk of febrile seizure. We use this parameter, and we use this to adapt apply to our research.